My name is Kazuo Maruyama from Tokyo, Japan, Teikyo University. So I'm a first people scientist in user of the NanoAssemblr in Japan. Okay. Also, I introduced that NanoAssemblr to the Japanese company, Nepagene. Okay. So start how to do this one. So my title of my talk is a preparation of nanodroplet for ultrasound theranostics. Okay, so how to, this one?
Yeah, sorry, the green one.
Okay. So the theranostics, maybe you know already. The theranostics is a concatenation of the two words, therapeutics and diagnostics. So the recently new journal was published since 2011. It's now an official impact factor is more than the 8.0. Okay, so that ultrasound imaging apparatus in the hospital is the ultrasound system. Also recently we can use like portable type, and also it's very important for breast ultrasound system, breast cancer ultrasound system. So you can use the ultrasound apparatus in hospital. And also recently it's very important apparatus is a minimally invasive ultrasound therapeutic system, so-called HIFU, high intensity focused ultrasound. I'm sorry, this movie is not work, but the focus point is temperature is very increased to the 80 degrees Celsius. Okay, so the ablation system of this by using this high intensity focused ultrasound for the uterus cancer and breast cancer, also prostate cancer. And also recently, this month, this extrabrate neural system was approved in United States. It's yes, this month. So the focused ultrasound is a non-invasive alternative method for destroying the small volume tissue deep within the brain associated with causing tremors. This approach by Insightec in the Israel. Okay, so also microbubbles are using now as a imaging agent for cardiosonography, and in Japan, hepatic tumor imaging. Okay, so that the size of the microbubble means a micro size like this. Okay, micro size, and okay. So this one used for the ultrasound imaging agent. So when exposed to the ultrasound to the bubble, so the bubble oscillated, and finally get cavitation. So this cavitation, and so oscillation is called introduced diagnostics, and also cavitation induced the therapy. So the combination of the bubble and ultrasound is very important for the theranostics. Okay, but the microbubble purpose is only diagnostics. So we need more. We need another purpose, means therapeutic purpose. So a new bubble with we need is with nano size and targetable and functionable are needed theranostics. So recently we succeeded to produce the freeze-dried theranostics bubble, so-called TV. It's Johan Unga, he is now here. The CRS meeting, we have a poster, 155, so please visit us. this bubble is made by the high-speed homogenizer, and we succeeded to the lyophilized product finally. Okay, and this theranostics bubble have a long circulation time in vivo. If you compare to the sonazoid directly go to the liver, so we cannot see. We cannot see the tumor blood circulation for a long time. But in the case of our theranostics bubble, we can see the long time for the about 1 hour. Okay, and also this is imaging. When you inject the bubble, theranostics bubble, we now also you can see the like this blood circulation in the tumor tissue. Okay. Yes. So also this bubble have a gene transfection efficacy. So when you inject the co-inject bubble, and in this case plasmid DNA of luciferase co-inject, and then expose the ultrasound transdermally towards the liver. So you can see when only plasmid DNA and bubble and ultrasound. In this case, only in this case, you can see the luciferase activity from the liver. So another case, you cannot see anymore. So please, this one, we have a CRS meeting. Johan Unga will give a presentation. So we need more. So now I'd like to introduce another bubble. Okay, so now I introduce a gas bubble. That means that gas bubble means that we use the powerful propane and powerful butane. In that case, this is already gas because boiling point is very low. But if you use a powerful propane and powerful hexane, in that case, the boiling point is very high. Means at the room temperature, there is a liquid. So we can make droplet. Okay. So in this case, this droplet can reduce the particle size, so that maybe this droplet can extravasate by an EPR effect. Also, in the blood circulation, when you expose the ultrasound towards the droplet, this droplet turns to the gas, then increase the size. Okay, so this bubble can use for user diagnosis and also therapeutics. So how to make a droplet? Originally, we developed this method, the powerful hexane or powerful pentan and lipid and DSP PEG lipid dissolved in the ethanol, and Vortex, during vortexing, put water at once. So the ethanol concentration reduced to the 25%. So it means that cloud formulation of the droplet is a very heterogeneous. And then centrifugal ultrafiltration for purification. So repeatedly like this, and finally we get the droplet. Okay, but this is takes a long time, and so we decide to use the NanoAssemblr. Okay, so in this case we use ethanol also. Lipid and polypropylene butane or hexane, and water 3 to 1. And introduce this microfluidics. And then it's very short time, 30 seconds something, and mix well, and we can get the powerful, the droplet. Okay. So in that case, Vortex is very easy but very heterogeneous. But the microfluidics, NanoAssemblr, if you use the uniform and highly producible, and I'm not check, but scalable maybe. But this price is a little bit expensive, so it's okay. But so that in the case of the microfluidics is certainly 25%. This is very important. Okay, and in the case of the Vortex, in the case large scale, it takes a long time. So that final the size of the droplet about 200, sometimes 300 something, and also stability is in the serum. The 90 minutes is okay. So, but not so stable. It's a limit. It's 90 minutes. So when you when you expose the ultrasound, okay, so there is no droplet, but when expose the ultrasound 1 megahertz, so the bubble come out. No, okay. Yeah, you can see the bubble. So like this. So only nano droplet you can see anymore, but expose the ultrasound. In this case, you can see image, ultrasound image. I think this movie, this animation, can you? Yes. So the droplet turns to the gas bubble. So this gas bubble, the size also increase. Okay, this is very important. So when you inject the droplet to the mice, and we check the left carotid artery, okay, so that you can very tiny. Yeah, here is you can see the gas bubble. Okay. So it's a gas content and also a bubble concentration. Okay, in this place. This is the summary. Okay, and now I'm thinking the set the NanoAssemblr in the hospital and mix nanodroplet and administered to the cancer patient with drug and expose the ultrasound like using like this equipment, and then so that bubble come out. The bubble come out, so bubble oscillation increase open the endothelial cell. Okay, so in this case, EPR effect may be increasing. Also, drug release from the blood circulation into the tumor tissue. I'm sorry, this is no movie. Okay, I like to, but in this case, when you inject doxorubicin and bubble and ultrasound, in that case, increase the tumor tissue concentration of the doxorubicin, and also enough, 1/5 is enough for tumor treatment. Okay, so when you combination with a bubble and ultrasound. Okay, like this. Okay, so recently in the Canada group introduced in the human, please. Oh, I'm sorry. This movie working? Okay. It's a Canada group, Sunnybrook.
For 8 years, Bonnie Hall managed her brain tumor with medication, but earlier this year, she was given difficult news.
It was starting to grow, and that I would have to see somebody, like see Dr. Mainprice.
Dr. Todd Mainprice is the lead investigator in a groundbreaking clinical trial. For the first time in the world, the Sunnybrook team will try to penetrate the blood-brain barrier non-invasively in a human, in Bonnie. Think of the blood-brain barrier as a saran wrap-like coating around the small blood vessels in the brain. Unlike other areas of the body, this saran wrap doesn't allow most medications to get through. And that has implications for many conditions, including brain cancer, Parkinson's, and Alzheimer's disease.
Our technique is to essentially tear holes in the saran wrap and allow the various chemicals that we want delivered to the brain to get into the brain.
And this is how. Bonnie is given chemotherapy and then later injection
No more?
of microbubbles or microscopic bits of air. Both will circulate in her bloodstream. Bonnie is fitted with this specialized helmet-like device, co-developed based on Sunnybrook research, and placed inside an MRI, which will help guide ultrasound waves or sonications to precise areas in her brain. The hope is this will cause the microbubbles to shake and temporarily rip holes in the blood-brain barrier, allowing medication to seep into the tumor. After several hours, an update.
So we just finished the sonications of the two spots, and we seem to have opened up the blood-brain barrier in both the spots. We're just going to verify that now. We're expecting to see an array of 9 dots in each of the 2 places that we open the blood-brain barrier.
And then success.
This has gone exactly the way we hoped.
Okay, stop this. Yes.
So these are the 9.
Yeah, so in this case, combination of the bubble and ultrasound. So I think liposome and also nanoparticle or maybe extravasate, very hard to extravasate from the blood circulation to the tumor tissue or another part, organ. So in that case, maybe this combination is very useful because we always use a genographic mice model. Okay, in that case, EPR effect very well, but in terms of the human, that's very, very hard. So that we need another method for extravasate to the lead to the tumor tissue and also release from the liposome and nanoparticle blood and introduce the tissue. So maybe this combination is very important, I think. Okay, this is final. Okay, please. Okay, so this is Ian. 2 years ago, you came here. He ate the horse meat. You know, horse meat. I didn't know that he is a vegetarian. So that, and last year she came here and visit my. Yeah, no, in that case, Saki. Yeah, Saki. Yeah, we really enjoyed that time. So thank you very much. My presentation is finished. Okay.
Yeah, we have another online question coming from Kevin. And the question is, what ultrasound pressure amplitude is needed to phase transition the droplets into microbubbles?
1 megahertz, and the case by case, but 1 megahertz and 5 watt per square centimeter is yeah.
So because these are lipid nanoparticles, right?
Yeah.
So are there any other interferences with the blood components?
Interference?
Interference of this? Thank you.
But this is I'm not cannot explain exactly, but I hope the no interaction in the blood. But already lipid bubble now using. Okay, so our case also similar. We use a similar lipid. So I think very low interaction in the blood. I think.
Thank you very
Yeah,
much.
thank you very much. Yes.